And we're just about to start our relaxation flow.
So we'll start with our connection. So thinking about our connection between our bodies and the floor. So what is it that we're feeling underneath our bodies, like what points of connection we have. So we should have underneath both feet, underneath the lumbosacral junction, underneath the TL junction, both shoulder blades, and then the back of the head. So if you're not feeling those, don't worry, we're just going to go through some postural cues now to help get you better connected. So I'm going to start with our feet, and we want to feel our feet equal from side to side, and also the pressure on the foot wants to be equal on each individual foot from the inner part to the outer part. We don't want our toes to be curled and scrunched up, so we want those to be nice and relaxed as well. So if you're feeling more pressure on one side than the other, just think about just shifting the weight from side to side and getting a little bit more balanced. Or if you're feeling like you're on the outsides of your feet more than the insides, just think about trying to pull the inner arch to the floor but keeping the outer arch on the floor. And vice versa the other way around. So if you're feeling more weight on the inside, try and shift the weight onto the outer part of the foot but keeping that inner arch connected. And then we'll work our way up to our lumbosacral junction, which is the junction between your lower back and pelvis. So to get better connected here, we're going to tilt our pelvis. So we're going to pull our spine away from the floor. So we're going anteriorly with our pelvis, and then we're going to tilt the pelvis the other way, posteriorly, reverse peeling the spine into the floor, and then pull it away, and lower, pull it away, lower, pull away, lower. So we're going between anterior tilt, posterior tilt, anterior tilt. We should have this gap underneath our spines on the floor, and then posterior tilt, we should have our spines curved into the floor. And then we just want to stop in the midpoint between the two end ranges, where your back should be flat on the floor with no gap, but also not caved into the floor, and that should give you a neutral spine, neutral pelvis, and get you better connected between your lumbosacral junction and the floor. And then we'll work our way up to our rib cage. So your rib cage and your pelvis, they want to be parallel with each other so they can communicate properly when you're breathing and create a better stabilisation pattern. So imagine that your rib cage and pelvis are like the pages of a book, and those pages want to be closed. So if you're finding that your pages are open and you've got this kind of rib flaring, you've got this arch underneath your back, try and imagine closing the pages of your book and trying to pull the pages together. So trying to pull your rib cage and your pelvis in parallel with each other. So by doing that, you should feel better connected between your TL junction and the floor. And then we're going to work our way up to our shoulder blades. Shoulder blades should be feeling equal from side to side. Shoulders themselves need to be in a neutral position. So out of this internal rotation, protraction, elevation, we're going to slightly retract, externally rotate and depress to get them into a more neutral position. And then the head doesn't want to be in extension, or neck doesn't want to be in extension, doesn't want to be in flexion. We want to push the head back down towards the floor. So you're activating the muscles at the front of the neck, so you should feel those working. Looking up to the ceiling. And then next, after we've got the connection, so you should be feeling better connected between your feet, lumbosacral junction, TL junction, shoulders and head now. So we're going to work on our breath, so you put the hand on the chest, hand on the tummy, and we're going to try and get the breath in the right order first of all. So when we take a breath in, diaphragm should go down. That should create a pressure, intra-abdominal pressure inside the abdomen, and it should mean that your hand on your tummy will lift as you breathe in and lower as you breathe out. So like I say, we're thinking about relaxation today, so just purely try and focus on your breath. Try not to let your mind wander. Try and focus on what your breath's doing. Try and focus on your breath lifting your hand on your tummy. Breathe in through your nose, out through your mouth. Breathe through pursed lips on the way out. Imagine you're blowing through a straw. Okay, so now we've got the breath in the right order. We're going to put our hands around our waist because we want to create this 360 degree of intra-abdominal pressure. So as you breathe in and your diaphragm goes down, that should mean that the whole of the abdominal wall, the whole way around, should activate or eccentrically contract. So it should feel like these muscles are expanding and pushing your hands away. So if you're struggling to feel that, those muscles, just cough first of all. Feel your muscles expand, and then try now and think about those muscles expanding and lifting your hands away as you breathe in. So you should feel this equally from front to back and symmetrically from side to side. So if you're struggling to do any of this, let's just start with the front bit. So put your fingers into the front bit, poke into there, cough again, and then just visualise those muscles lifting and expanding and pushing your fingers away. Keep doing that. I'm just going to turn the music down a tiny bit, so I don't know if it's too loud. Let's turn it down. Breathe in. Okay, so if you've got these front bits now, work your way around to the sides, put your thumbs in, cough again. Feel those muscles lift and expand outwards. And now breathe and expand into those muscles. Try and time the front and the sides together. And now grab around the back, so thumbs into the back. Everyone seems to struggle with this bit. So cough, feel those muscles, and now really work on those muscles, pushing your thumbs down towards the floor. If you can feel these muscles in the back, you're pretty much more than likely going to be expanding into the front and sides as well and using your pelvic floor effectively. This exercise alone, if you're going through like an acute episode of lower back pain, even just doing this exercise alone will help to release tension in those muscles if they've gone into spasm. So this is a really nice way of helping to ease off your lower back pain. Okay, so we've got the breath, the 360 degree breath, and now we just need to know how to create a brace for when we need to create more stabilisation. So for when we're doing things like carrying the shopping or the kids or lifting weights, we need to be able to have an appropriate amount of brace. So what you don't want to do is suck your belly button in or tense or clench. It's an outward push. So when you've got your 360-degree breath, I want you to imagine that you're farting and just do an outward push and create a little bit more of a brace in the abdomen, so an outward brace, and then carry on breathing with that activation. Try not to let your muscles relax completely, so we're trying to keep the fingers outwards, pushed away. Okay, so throughout this flow, try and remember your connection, try and remember your posture, try and think about your breath, your 360-degree breath, and when you're doing something that needs a bit more stabilisation, create that outward brace, and just really try and focus on everything that we've just gone through. Just try not to let your mind wander, try and think about all those different things so that it doesn't think about all your worries and your stresses, because today's is all about relaxation. So first of all, we're going to put our feet together, hands out to the side, shoulders 45 degrees, and we're just going to tilt the knees one direction, head goes the opposite direction, and then pull them back up. So as you're pulling them back up, try not to just yank them back up, but you're going to be, if my legs are going to the left, I'm going to be using my right oblique muscles to pull the knees back and pelvis back, and then drop the other way, and then pull back, and then drop, and pull back. And we're just going to go side to side, breathing, focusing on our breath, focusing on bringing the legs back using our oblique muscles. Just do one more each side. And then we're just going to put our feet back to hip distance, and we're just going to stretch one leg out and bring it back. Stretch the opposite leg out, pull it back, just alternating sides. Imagine you've got your foot on a plastic bottle or a ball, and you're rolling the ball away and pulling it back in. Better on a smooth floor. My feet keep getting caught on the carpet. And then you're gonna float your arms up into the air and then back round in the wall. So up over your head, bring the arms round. As you're taking your arms over your head, try not to let your ribs and pelvis lift, so going into that open book, so they want to stay closed, so connected. And bring the arms round. So we don't need to try and work on improving that range in this particular flow, because this is about relaxation. So just go as far as you feel like your ribs are starting to lift, and then just take them back round and open your arms out. And you might just find that each time your arms get a little bit lower anyway. Focusing on your breath, and then we're going to Take our arms and take one leg at the same time. Pull it back in, opposite. Nice and slow. Let's do one more. And then we're going to just float one leg in the air and lower. And other leg. Trying to concentrate on the pelvis, making sure that your pelvis stays in this neutral position. Try not to let it tilt as you're lifting one leg or drop to the floor. Keep breathing, focusing on your breath. And then we're going to take both our legs up, so bring both the legs up, so create your 360-degree breath and your brace, your outward push, so that as you lift your legs, your pelvis doesn't tilt forwards. So up and down, focusing on your breath, and then we're just going to hold it in your 3-month supine position. So 3-month supine, feet should be neutral, pointed to the head slightly, so in dorsiflexion. Feet want to be higher than your knees, knees over your hips, hips in external rotation. And we're just holding and breathing and focusing on our breath. Now bring the feet into the hands into 6-month supine. If you can't grab hold with your hands without going into this kind of awkward position, if you've got a TheraBand or a belt or a towel lying around, I should have mentioned this earlier, just put it round your feet and hold it there, hold it in your hands. Or if you've not got that nearby, just hold the 3-month supine position. And we're just breathing again, focusing on our breath. Legs down, and we're going to go into our roll. So this is where Niam's ideas came in again. So I'm just going to do the roll. So we're going to do a roll, and then as we come back, we're going to lower our legs and then go the opposite way. With the roll, what I want you to do is you're going to lift your head slightly, look the way you're going, lower the arm down, and then roll to that side. Make sure that your body comes as one, so you've got a Lego body, so pelvis. You end up on your side with a gap here, so we don't want to be a banana spine, so nice straight spine. And as you're coming over, try and control the movement. Don't let yourself flop or throw yourself back. Okay, so we're going to lift the head, look that way, roll. Top hand as if you're trying to reach for something, roll back, drop both legs, keeping that neutral pelvis, go the other way, and drop the legs, pull away, legs, keep doing that, just alternating from side to side with the leg drop. Oh, got my legs then. Let's do one more side to side. And drop the legs. So now this bit's going to be a bit different as well, so see how it goes. So what we're going to do is we're going to roll from our backs onto the side and then come round into 4.5 month prone. So one leg wants to be hip and knee bent, one leg wants to be hip and knee extended, and then we're going to roll back onto our backs in the wrong place. This was easier before when I wasn't speaking, and then come round on the other side and then roll back and onto the other side and back and back. Keep rolling from side to side. And then just finish off in your 4.5 month prone. So I'll try and come this way so you can see me a bit better. So with your 4.5 month prone, we're going to be one leg extended, one leg bent, and then you're just going to sort of have a contralateral support. So if your right leg, is supporting, your left forearm will be supporting. So we're just going to hold this position here, focusing on our breath. With this, you don't want to let your spine go into this collapsed sort of lumbar extension, so you want to try and hold in a neutral position. So hold in that position. And now come into your low quadruped and then pull it through into the opposite side, so the opposite 4.5 month. So now your left knee will be bent, hip will be bent, right leg extended, and it'll be your right forearm pushing into the floor. So just hold in that position. Then try and keep the shoulder active so we're not letting the shoulder collapse. And now pull that leg back in, into low quadruped. And then we're just gonna alternate from side to side. So we're gonna take one leg out, be free with this hand, pull it back in, and then alternate to the other side. And back. So we're alternating from side to side. Last one. Now come into your low quadruped position. And so first of all, with the low quadruped, turn this way. The aim is to get into a good posture. So we try and get out of this flexed thoracic spine posture in this position. So we want to start by tilting our pelvis backwards and forwards, find your neutral spine. We want shoulders active, so external rotation, depression. And then we're going to try and pull our upper back into extension, so out of this flex position, into extension without losing it into the lower back, so without going into extension through here. So get your knees slightly wider than your hips, and you want 90 to 120 degrees of hip flexion. Toes will come about here, shoulders active. So push the floor away, externally rotate and depress the shoulders, tilt your pelvis backwards and forwards, find your neutral spine, and then work on pulling your upper back towards the floor. And we're just going to hold that position. If you feel that when you pull the upper back down, you go into lumbar extension, just try and hold the upper back where it is and then tilt the pelvis into a slightly posterior tilt to get your pelvis into a neutral position, and your lumbar spine back into neutral. And then we're just going to hinge backwards, so we're flexing the hip, not the spine. And then when we come forwards, we're extending the hip and not the lumbar spine. And back. And forwards. Back. And forwards. And back. Okay, so now what we're going to do, stay in your low quadruped, and we are going to stretch one arm forwards, lower down into the floor with the head. Feel that stretch down here, but as you're going down, try not to lose your lumbar spine into extension, so you're trying to keep your lumbar spine neutral. So we're stretching down. Keep the opposite shoulder active, pull it back, opposite arm, so we're alternating. And then what we're going to do now is, keeping one forearm flat on the floor, we're going to extend one elbow and rotate the spine, look up towards the ceiling and down. And now do the opposite side and down. Alternate side to side. Do one more. Come up into your quadruped. So again, we're going to first of all get your neutral, shoulders active, upper back in extension, and then we're going to hinge. Nice and slow, hinging the hip, flexing the hip, not flexing the lumbar spine, and come forwards. So really try and work on this movement coming from the hip. So we don't want to go back and just round through here. So we're flexing the hip. And going backwards and forwards. And as we come forwards, don't lose it into extension. Backwards. Forwards, backwards, forwards. Okay, so we're going to do kind of the opposite now. We're going to actually move our spines. So we're going into the cat camel, so we're arching one way. and then arch in the opposite direction. So as our spines curve up towards the ceiling, take your head down towards the floor, and then reverse and look up to the ceiling. And down. Do a couple more. And now we're going to, in this quadruped position, we're going to bend one elbow, stretch the opposite arm out. We're going to stretch that right shoulder, back of the shoulder, underneath the shoulder, come up, and then lower the other side. And back up. Feeling that stretch. And now what I want you to do is you can either take your hand palm down or palm up underneath. So you should feel that stretch along the back of the shoulder. And come back in. And go the other way. So alternating sides. Do one more each side. Okay, so now we're going to go from quadruped into bear. So find your neutral, hands flat on the floor, shoulders active, upper back and extension. And then we're going to create our intra-abdominal pressure and brace and lift the legs and lower. And lift and lower, lift, lower, lift. And now we're going to go from this position, the bear, into a downward dog. And hold. And back into bear. And back into downward dog. Back into bear, into downward dog, back into bear, and now we're just going to do the bear hinge, so we're hinging backwards, trying to flex the hip, not the spine, and forwards, and back, and forwards, and back, and just lower. Just give your legs a little shake off, and then we're gonna go from bear. So lift your bum, and we're just gonna hinge the hip backwards, walk the hands backwards into your squat, and then we're just gonna lift the bum in the air, so extend the knees, feel that stretch down the back of the hamstrings, and lower and lift, just go in between those two, lower, lift, lower, lift, lower, back into your squat, and we're going to stand and lower and stand, lower, stand, lower, back into the squat, and then we're gonna drop one knee to the side. Feel that stretch in the groin area, and then go the opposite way. Other way. Opposite way. Go the other way. And now in this position, we're going to turn and lift that back, straighten that back leg, lift the bum in the air, hands on the floor. Hold, lower that leg down, into a hip flexor stretch. So I'm just going to keep my hands down. You can see my head. Keep breathing. And then we're going to go into this tripod hinge. So hands flat on the floor, and then we're just going to hinge backwards. Forwards and back. Trying to keep the spine nice and long and straight. And now we're going to come into your high kneel. So high kneel, don't have your foot too narrow, out to the side slightly. Pelvis, you don't want this hip hike. You want to get your pelvis level with the floor, parallel with the floor. And we want neutral spine. So pelvis level. And then we're just going to hinge backwards again. And then up. Pelvis level, curl the back foot under and shift the weight forwards and stand. As we're standing and lowering, you want to try and keep your pelvis level with the floor. So you don't want to just go out to the side. You don't want to keep your pelvis wonky as you're going up and down. You don't want to let your knee collapse. This wants to be level, knee wants to track the second and third toe. And lower slowly. Come up. Down. Nice and slow. Up. Down. Up. Down. Do one more. Okay, so now we're going to come back into this squat and go the other way. And then, so we're here, put my hands down, try and get my back flat, and try and lift, bum into the air. This side's always a lot tighter, so I can't get a good range with this. Hold that position. Lower into your deep psoas stretch, hip flexor stretch. Keep your breathing, focusing on your breath. And then tripod hinge again. Okay, back into your high kneel, pelvis level with the floor, hinge backwards. Okay, high kneel, pelvis level, curl the back foot under and stand. Lower, stand, lower, stand, lower, stand. Do one more, and then stand. I'm just going to finish off by just doing some roll downs. So look up to the ceiling, down to your feet, and then vertebrae by vertebrae, just roll your spine. Try and touch the floor, and then roll the opposite way. When you're doing it, going down, if you need to bend your knees, that's absolutely fine. Rolling back up, roll the shoulders, look down, roll, back up, and just do one more. And we're all done.